Hi everybody, welcome to week 6 of your practicum course. I'm coming to you today from Florida. It's chilly today, but otherwise it has been actually pretty sunny and warm. A nice change of pace from winter in Utah, so it's exciting to be out here for a few more days. So this week we are talking about applying GCU's mission and vision statements in combination with your practicum site's mission and vision statements, and seeing if those are compatible, if they're synergistic, kind of what's going on there. And then we'll also be discussing your personal learning needs that you are discovering as you're going through your practicum. So personally, with my part-time teaching position at GCU, my values are very congruent with GCU's vision and mission. My full-time position, though, is with a public school district in Utah. And in that setting, I cannot share my religious views quite so freely. I do usually wear my cross daily, so people know that I'm a Christian. Also, I hope that my actions are reflective of that. Luckily, I feel that people in my district act ethically and with integrity. I'm usually quite successful at getting my patients whatever it is they need to be safe while they're at school during the day. And of course, like anywhere, staffing is an issue. There are some other things, such as in Utah, our maturation program does not include sex education. There is some material in the biology courses about reproduction, but sex education is woefully lacking in Utah. So that's kind of a values thing that I would say is a little different. So anyway, I'm looking forward to hearing about how you and your values and things like that are meshing with the vision and mission. I'm having trouble with those words tonight. At your practicum site. And then also what you've been able to identify about your learning needs now that you're actually in your practicum setting. So, all right. In addition to those things this week, we are also going to be talking about concept-based education. I felt that we needed just a little more content in our discussion forum. So concept-based education is a national trend within nursing education, and I want to make sure that you're familiar with it before you go out and graduate, and maybe some of you are. I'm not sure how much you've discussed this in your previous classes. Basically, the idea is to teach our nursing students deeply about many concepts and then apply those to patients with certain exemplar or example conditions. Okay, so some of the clinical concepts might be inflammation, oxygenation, perfusion, and you can see how many different disease process and conditions those things might apply to. Other concepts that go across the curriculum are things like professionalism, advocacy, caring, developmental needs across the lifespan, things like that. So I'm going to include one or two websites and some other materials with this post about concept-based education. It very much is student-focused. And the main benefit to teaching students with concept-based learning is that they will be able to care for many different types of patients with many different diagnoses, but many underlying pathophysiologic conditions without having so much content overload in the nursing program that makes it impossible for students to retain the information. So an example might be care of the patient with neurologic compromise. And so in MedSurg 1, or somewhere earlier in the curriculum, things like uncomplicated stroke, acute Parkinson's Parkinson's disease might be exemplars, but then we'll talk about different neurologic and nursing concepts that are applied in general for neurologic patients. And then we'll use some exemplar conditions to apply them. There usually ends up being some pre-material that the students are prepared in some way for class. There's not a huge amount of lecture, although there is some. And then there are a lot of application exercises, case studies, definitely, but other application exercises so that they are taking these complex concepts that they're learning about deeply and applying them to the clinical setting. And again, really the whole basis of this is that we were finding that there is so much content overload in traditional nursing programs that there was just not any way for students to be successful at retaining all of that information and then applying it in the clinical setting. So look over the different materials and then let me know your thoughts about concept-based education. It's kind of different if you went to school in a traditional nursing program like I did. All right, guys, so I think that's it for now. I'll see you in the main forum.